what should I be taking or doing to bring not only my eyes back to health, but my body? So this is my iris. So I have a camera. And if you ever come to my office, I'll take iris pictures and we'll put them up on the screen. This is my right eye, and this is my left eye. And so you can look here, there's a pigment here. And that pigment, I'll show you the map in a minute, that's the liver meridian of the left eye. So when I have a pigment there, it says, maybe there's something going on in my liver. And so what I ended up doing was a liver cleanse, and it did a lot of really great things for me, my eyesight and other things. So we look at pigments, we look at, shapes of it, we look at all the fibers, and we can tell different things like the pupil of the eye. If it's not shaped round, different parts of the pupil reflect directly to our spine. So if this was, say, oval, and there was kind of a flattening here, we could say, oh my God, this is a cervical problem. Let's see what happened here. So what's some of the history of iridology? Well, it goes way back, Chinese, Japanese, Greeks. The father of iridology in Europe in the 1800s in Budapest was Dr. Ernest Pestley, and he did a lot of mapping of different parts of the iris. And then Bernard Jensen, who had a naturopathic practice in California, and now his daughter-in-law is taken over. He has really developed iridology, and this is, let me go to this. So this is something that he did. If you look at the left eye, look here, spleen, ovary, heart. So it maps the body. This is the left eye, that's the right eye. So if we see configurations, we can say, oh, heart area or respiratory area. So the map is what all these pioneers came up with. So we get to take the picture like this, and then we can kind of map it out and go, okay, these are your nurture points. These are the areas where you might need some help. All right. So I'm not going to spend a lot of time on this, but the blue-eyed person, their issue is lymph system. Okay. They've got to work on their lymph system. The second is the mixed. So it'd be like hazel eyes, light brown, and I'll show you some pictures of it. That would be what we call the mixed. And then the third condition is dark brown, like that. Okay, so, and then we'll use the chart to figure out, okay, what are we going to do here in terms of maybe giving some counseling, whether it's nutritional, herbal, those kinds of things. So what we'll do in a little bit, those that want it, I can look with my magnifier and at least give you a little bit so that you've got some tendencies. And then if you want to come and see me sometime, we can take some really detailed pictures and, that would look like that, and then really go into some depth with it. So any questions or comments about the iridology part of it?
You said blue eyes need to work on lymph.
Lymph, yep.
Hazel eyes.
Hazel eyes would be more liver gallbladder, and then the dark brown tend to have to work on blood. Like you could have anemia or some kind of blood disorder. So again, I'll look at that and determine. I wanted to go to this one briefly, because we didn't get to do it. So again, we're working with glasses, we're working with eye conditions, And these are some of my mentors. Some of them are holistic eye doctors, some of them are body workers. So I'm really grateful that I've met so many people to help me kind of take the work to a different level. And we talked about eyesight and vision. Eyesight is reading the chart, and vision is more of how the brain sees it. And that machine is really horrible because, you know, you're stuck behind there and you got to make a guess on what you like better, one or two. It's not a very accurate way. There we go. So we talked about important facts of the eyes. It's from the brain. The eyes carry 60 to 80% of body tension. So our eyes carry a lot of tension because we're so visually centered in the way we process information. Oxygenation and hydration are very important as well. So those of you that suffer dry eye, this is a major lymph part of the eye because of the eyelids. Anyways, the eyelids carry hold the glands that produce the tears. So there's the eye lymph system. Functional anatomy means we're looking at the function and not just the structure. How we use our eyes affects the anatomy. And, you know, we're looking at the muscles, we're looking at the cranial nerves. We're even looking at things like posture. If your posture is off and you're scanning towards one side, it can actually cause astigmatism. So you want to have your reading materials in the middle of your vision. And in the healthy lymph system, we're looking at cornea, lens, that's cataract, vitreous, that's where the floaters are. And the eyes do have their own lymphatic system. So if you have cataracts, glaucoma, dry eye, eyelid, inflammation, even macular degeneration, if you improve the lymph system, you can improve your eyesight and vision. Don't live out the doctor's diagnosis. You know, you've all come in here, I've got this, and then you just live that out, and that can be really limiting you. So try not to do that. So with dry eye, we talked about castor oil massage, compresses, which you could get at Herbs, etc. The fats and oils seem to be very important. In glaucoma, we talked about it's a vascular disease. NAC is really good. The B vitamins, alpha lipoic acid, coleus. Those are all things that you can use. Nobody in here is really dealing with cataracts, but cataracts can be caused a lot by sugar. So be very careful. If you're eating sugar, you could develop cataracts. So you want to be careful about that. So in this slide, this is the front of the eye. This is the lens. This is where the vitreous, the posterior vitreal detachment might be. And look at how small the fovea is. It's just this little area there. And look how much of the retina there is besides the fovea. It's such a small part that those progressive lenses just dial it in. Here's another picture of the eye with the blood vessels. Again, the blood vessels need to be really healthy. If you have healthy blood vessels in the eyes, you're going to keep your eyesight and vision. That's the lens of the eye, looking at that. Talked a little bit about floaters. So collagen health, liver detox, quercetin, taurine, bilberry, vitamin A, hyaluronic acid. That's another one sometimes that's used. And lymphatic exercises, blue blockers. We talked about blue light. Again, another picture of the eye. So this is the retina looking, when you look in, when the doctor looks in, and this is the nerve right here, the optic nerve. And these are the vessels going in there, which will go back to the brain. So this statement, the retina has the highest metabolic need of the body, and it's made of a sea of microcapillaries. And here in macular degeneration, nobody has said this, but there's a condition called macular pucker. or epiretinal membrane disorder. That's where the vitreous pulls away from the macula. So it's kind of a form of macular degeneration, but nobody seems to be dealing with that. So, and that's the Amsler grid. So that's a way you can test your macula to see if it's working. If you get a distortion, then the macula is probably not working normally. And then on this side, VEGF, this is, we call this the condition is called angiogenesis, and that means when blood vessels are produced behind the macula, but those blood vessels are kind of weak or flimsy. That's what creates the edema. And the reason why your eye is doing that is because you're not getting enough nutrients to that area. So people with wet AMD have to really work hard at getting the lutein, zeaxanthin, and astaxanthin there. And so you're trying to inhibit the VEGF because that lowers the blood vessel formation. There's kind of an angiogenesis situation that occurs not only in the macula, but even in certain tumors with cancer. And with the retina, we talked about like nitric oxide, which is a vasodilator, and the carotenoids, lutein, zeaxanthin, and astaxanthin. So one of the things I counsel people on is when they go for an eye exam, what to ask for and how to navigate so you're not getting the wrong lens. Like number one, be very careful if they want to prescribe progressive lenses, maybe get 2 different pairs of glasses. You don't want to get a lens that's too strong for you. So you can say to the doctor, hey, can you back it up a little bit? I don't need all this, stuff like that. We talked about myopia as being more fear-based and you're pulling the world in. And the higher the diopter, the earlier it probably started in your childhood. And then farsightedness, pushing the world out, anger, and then presbyopia is just another sign of hyperopia. And let's see, if we talk about astigmatism, that's often linked to myopia, but it's twisting the world, twisting the body. And strabismus is when the 2 eyes aren't working together. So, all right. Any comments, questions? All good?
It's a lot of info.
A lot of info. So now that I have your email address, I can email you those in a PDF if you'd like. Okay, because it's a lot of info. And we didn't really, we didn't really do that this morning. It was great. We just had our conversation, and then to show you through the slides what we were going to do this morning. All right, commercial announcement. I'm doing a workshop in November in Kauai, Hawaii. So if you want to come there, you can look at this. Any practitioners here? I don't know if there are any. I'm doing a practitioners training starting next year, trying to teach practitioners how to do this work. And then I'm doing a class at the end of October. It's a 2-hour class on movement. And it's at my place called the Geodome. So I'm in a big geodesic dome. And if you want to come, just copy down the info and contact me. It's a 2-hour class. One of the modalities I studied was continuum movement. Continuum was started by a woman named Emily Conrad. And I became a teacher in continuum and taught it at Esalen. And I've kind of incorporated into my eye work, but I'm not affiliated with continuum anymore. But we take some of the things that I learned there, and it's a lymphatic stimulation, but it's amazing. And so we do movement, we work with sound like the palm hum, but you're on the floor. So it's kind of a really And coming to the dome is really great in Tasuki. So
But it is for your eyes.
partly for your eyes. Yeah, well, I'll be talking about eyes.